Happy March 2020, everybody. I am in my living room with one of my favorite practitioners, Deb Schindele, who's actually my nurse practitioner. And I invited her over today because Deb has a very unique perspective on breast cancer care, because not only is she an amazing practitioner in my practice, but she's gone through this process herself, and she has some really interesting insights into how she chose what treatment she was going to do and how it kind of all came to fruition, and how you finally reckoned with your brain to bring together Eastern and Western medicine. So first of all, tell me a little bit about yourself, because you are not the average nurse practitioner. You're smarter than the average bear. Your IQ is off the charts. You got a PhD. And I'm just really blessed to have you in my practice working with my patients. So give me the Deb Schindele story.
So first of all, I'm incredibly honored to work with you. And when I was 8 years old, my next door neighbor, my second mother, my mother's best friend got breast cancer. And that started out my entire life realizing that it just set the course, that I knew that that's kind of what I was going to do. And I ended up spending many years doing cancer research. I made anti-cancer drugs, got my PhD at University of Washington, postdoc there, and then worked in biotechnology.
What's your PhD in?
Organic chemistry, and then
Oh
my
my
postdoc
God.
was biochem.
Organic chemistry? Oh,
I know.
I took that in Hawaii, which was probably
I know.
the best way that I could pass it, because at least I could go to the beach and wash it off of me at the end of the day. But a PhD in organic chemistry. God love you.
So it gave me the opportunity to make drugs that could be life-saving, and for me, that was just how I was called. So after working there for many years, a lot of things changed. I got disabled at one point in 1995, and I had surgical interventions to correct all the problems as best as it could, but there was really nothing left in Western medicine that could fix me at that point. And I'd been running biotech companies and traveling all over the world, and I led a very amazing lifestyle, flying in private jets and meeting with all the upper echelon of every kind of corporation. And then after being disabled, I really had to take things back and really go inward, because there was really no way for me to function in that kind of arena anymore. I couldn't control my body. I couldn't sit. I couldn't walk. I couldn't do much of anything. So really changed my life.
So when did you become a nurse?
So that was rather late in life. I loved...
When you were 30?
No, a little later. So long story short, I recognized that doing the mind-body work was fantastic. I did a tremendous amount of work with patients, clients, but I wanted the medical piece. And being in your, I'll just say, later part of your life, I recognized that probably the fastest and most cost-effective path for me to be able to practice medicine in addition to the mind-body work was to become a nurse practitioner. So I became a nurse, worked pretty much in the ICU, cardiovascular ICU, et cetera. So got some really good training, and then became a nurse practitioner, and eventually worked in a community health center, and then set up my own practice doing very integrative sort of care, primary care, but very integrative primary care.
So clearly when, when you felt a lump under your left armpit, probably freaked you out a little bit as a nurse practitioner who, let's just say, you weren't excited about the prospect of utilizing Western medicine. Is that honest?
Totally honest.
And you had a little bit of a tough path getting the diagnosis. So
I did.
It also gave you pause to the wonders of Western medicine.
It did. So when I first found the lump, I was praying it was, mobile, squishy, tender, assist, a lymph node that was a little angry. But unfortunately, it was very hard, fixed, and non-tender, which are not good qualities for a lymph node. And so I've suspected very strongly that it was probably as a result of breast cancer on that same side. But the journey then began to prove what on earth I had and to find a way to treat it. And throughout my entire life, I swore I would never in a million years ever do chemotherapy or radiation therapy.
Careful what you put out there in the universe, because the kind of cancer that Deb was diagnosed with is called triple negative breast cancer. And it's, we use the acronym TNBC. And triple negative breast cancer means that on the cell surface of the cancer, there are no receptors. We lack receptors, which means we lack the ability to have a targeted therapy, such as an anti-estrogen medicine or a drug called Herceptin, to go dive in and do it. And I believe that, your lymph node was 4 centimeters?
Almost 5.
Almost 5 centimeters. So her lymph node was the size of a big lemon, and there's really no other path forward than through the treatment of Western medicine, which is chemotherapy, surgery, and radiation. So the reason why this is such an important topic is I get patients every day in the office that say, I absolutely don't want to do this. And I know you were one of those people. And had I been in Sedona in January of 2017, actually 3 years ago, hopefully I would have been seeing you, and I would have had the conversation with you where I would have been able to educate you and empower you to understand that, Western medicine isn't evil. Western medicine has given us amazing gifts to treat specific diseases in a way that you can't do with something alternative or something complementary. So how did you wrap your head around chemotherapy, surgery, and radiation? Because that's a big lesson that I think we can help share with a lot of women who deal with this every day.
So initially, I came to realize that I have 2 children and I adore them. And I really decided that I wanted to be around to be with them. And I was faced with the decision, and it's a very difficult decision, but the decision was you line up with traditional Western medicine, chemotherapy, surgery, and radiation if you want to live, because otherwise triple negative will take you out in just a matter of months. Or, if it's time for you to go, feel free to do nothing or perhaps try an alternative. Maybe it would work. But I just didn't think I could wrap my head around mind-body medicine enough to turn things around fast enough. So I really thought that I'll use that, but I'll take the traditional therapy because I really do want to live. And it was really a choice of living. And so I went from feeling I would never do this to just, you know what, I got to line up with it. And when they first told me about adriamycin, one of the chemotherapy drugs, which is a really challenging drug, it's bright red and people have terrible names for it that I'm not even going to bother repeating.
It is a transformational drug, though, for triple negative breast cancer.
It
melts
beautifully.
That cancer away like putting a stick of butter on a hot pan. It will melt it away. And I think that's one of the things doing what Deb did was called neoadjuvant chemotherapy, which means chemotherapy prior to surgical intervention. And for triple negative breast cancers and HER2 positive breast cancers, this has almost become the mainstay when a cancer is already beyond 2 centimeters. Deb's had gone to the point where her lymph node was already 5 centimeters. And people don't recognize that these cancers come out of nowhere. Triple negative breast cancers are the cancers that are more highly associated with the BRCA1 and 2 genes, which is why Angelina Jolie chose to do her risk reduction surgery. Because I have literally seen patients with a BRCA1 gene with a normal screening mammogram in March and a 4 centimeter cancer in September. And it wasn't that they didn't do the appropriate screening studies. It's because these cancers are bad actors. They turn normal tissue into a rapid fire process where cancer cells turn over so fast. But by virtue of the fact that they turn over so fast, how quickly did you notice your lymph node disappearing with chemo?
So I had 1 round of chemo and it felt like it just was, my lymph node was changing. It didn't feel smaller. It didn't feel like it was gone, but it just felt a little different. And then by the 2nd round, it really felt different to me. It felt spongier. It didn't feel as solid. It felt like it might be getting smaller, but I didn't know if it was wishful thinking on my part because of course you want it to go away. And then by the 3rd round, I was like, no, this is definitely going away. And I went into my provider and said, hey, can you just verify that I haven't, wishfully thought that this has shifted, that this is really smaller? And they were, absolutely this is. And by the 4th round, I really couldn't feel it. So it got to the point where it shrunk, and then I had another 12 weeks of another regimen of chemotherapy. And then I had the good news from magnetic resonance imaging, MRI study of the breasts and the armpits. And there was no evidence of disease left after I'd completed all that chemo.
So we call that a pathologic complete response, or PCR. it's amazing when you go to surgery and you can prove that your clinical complete response is validated by the pathology, which is what the pathologist looks like under the microscope. So basically, Deb went from a stage, you were probably stage 3 because of the node, right?
Yeah. Well,
To stage 2. Well, it depends on the AJCC classification of staging, but somewhere between a stage 2, borderline stage 3, to no evidence of disease, which is amazing. So the other question came up for you was, what do you do then surgically? Because I have women in the office every day that say, cut off my breasts, I don't want to get cancer again. And that's when I have to pull them back and say, no one dies of breast cancer in the breast. You die if breast cancer spreads elsewhere. So cutting your breasts off doesn't save your life. So what steps, including genetic testing and everything that you went through to make your final decision? What was it?
So first and foremost, genetic testing, because if I carried a gene that placed me at very high risk of breast cancer, I was going to have a double mastectomy, no question about it. So I did do genetic testing, and I was negative for all of the genes that are associated with breast cancer. Yay. And then subsequently, I really thought about it, and I felt like, well, I've gotten pathological complete response from what we can tell from the MRI. We hadn't gone in and actually taken any tumor or tumor bed tissue out, so we didn't know for 100% certainty it was true pathological complete response. But then I like having breasts, and I like having sensation in my breasts. To me, they're a big part of who I am, my sexuality, all kinds of things. And I wanted to keep them if it was possible. So that led me down the path of lumpectomy. And with
Well, you were going to need radiation therapy either way because your lymph node was positive. So you weren't going to get out of radiation by having a mastectomy. But I give kudos to Ben Anderson, your surgeon, for empowering you to make a choice based on knowledge and not fear, because there are a lot of women that I have a really tough time talking them out of a mastectomy when it's not going to change their survival. It doesn't change whether you live or die of breast cancer. And you chose a surgeon who has a great track record for being empowering and doing the right thing. And I got to know Ben years ago when I went to his cancer center in Seattle and was working with them to do intraoperative ultrasound localizations, because I had been doing them for a very long time. And we were trying to improve the journey of a woman through breast cancer, not having to go through a localization procedure. So the fact that you got great counseling, you are very, very fortunate, because it brings up the point of getting second opinions. Patients need to know that the options they get are ones that any other doctor would have given them. And so any great words of advice to any women that are watching this video that you would want them to think about, do whatever, besides coming to Sedona for us, because we are like a rock star team. But give the advice that you wish someone had given to you the very first day that you felt that lump and knew you had cancer.
It's very much in alignment with what you do in a consult, where you talk to the person and you kind of walk them through, this is the journey. These are the steps that are going to be involved in your treatment. And there are different players that are going to play different roles at different times during this treatment. And this is what your options are going to be. And as we gather more and more information, we're going to make even a better informed choice as to what your best way of proceeding is. So that's, I think, number one. And then with regard to the surgery, it's really such a personal decision. There's a cosmetic effect of every day when you look in the mirror, what do you want to see? You know, do you want to see a mastectomy, a traditional mastectomy? Are you okay with that? Do you want to do a nipple-sparing mastectomy?
Are you a candidate for it?
Are you a candidate for it? Do you want to go as simple as you can and as conservatively as you can, if it's possible to do a lumpectomy? And with the surgeries that you do, lumpectomies, I sometimes have a hard time when the patient's a few years out, even telling they had a lumpectomy, because the scar's so well, I'll just say, hidden, disguised in their natural anatomy. It just is, the outcomes are beautiful. And so that's one piece of the puzzle. Having breast sensation is another piece, because when you have a mastectomy, that's a very different result than having a lumpectomy. There's a big change. And then what about the fear factor? Are you so concerned with getting breast cancer recurrence or getting breast cancer in the other breast that you're like, you know, that's
You mean the scanxiety? I call it scanxiety. Scanxiety is the fear that envelops a woman when she goes for her mammograms, her MRIs. I just saw you have it recently. But your anxiety is getting better because we have amazing dedicated breast imagers and we're doing everything we can and we're on it. Like, you're on this. So I hope your anxiety is going to go down over the years. But I want you to look at the camera and tell women out there who are afraid of traditional treatment how you overcame the fear of diving in and doing what you needed to do to be here.
So first and foremost, I just decided, guess what? I'm going to choose to live. If I want to live, this is what I need to do. I believe in not pushing against or resisting anything. So if I was lined up with that, I said, I'm going to allow this treatment to serve me. I'm going to allow it to dissolve this tumor. I'm going to allow it to get to the other side where I get cure from this particular disease. And so every day I envisioned this tumor shrinking, melting away. I floated in a deprivation tank every single day for 105 days. And during that time, I absolutely envisioned that it was melting away and that I was receiving extraordinary healing and allowing it to benefit me. And then after the chemo was done and I healed from that and then had surgery, again, I allowed the surgeon to do what he needed to do, visioning that I would have the best possible outcome in my axilla. So they only took 3 lymph nodes and just everything would be well. It was all signs of disease would be gone. And then after healing from that, every time I went into radiation, I envisioned again that radiation therapy benefiting me, and I allowed it to complete the healing. So on a physical level, I feel like I had the benefit of modern medicine and I used the mind-body approach to benefit me. And then after all is said and done, I was cured. And then luckily came the next part of the journey, which is
we're going to
actually
talk about
healing.
in a little bit. But right now I want any woman who's just gotten a diagnosis of cancer, there are some excellent websites which will be on the video for you to be able to click directly so you can go to them. Breastcancer.org is probably the foremost site on the planet for appropriate information for breast cancer treatment. Full disclosure, I do sit on their advisory board. Marisa Weiss started this organization years ago, and it's absolutely amazing. So breastcancer.org to learn about treatment options, up-to-date everything. There are breast cancer websites for triple-negative breast cancer, which if you are diagnosed with triple-negative breast cancer, don't go into fear mode, become empowered like Deb did, and make your journey the very best it possibly can be. And thanks.